Franklin County Commissioner Kevin Boyce joining us today. Thanks so much for coming in. And of course, we are just days away from rounding out May, which is Mental Health Awareness Month. But it's something that has, gained a lot of attention in recent years. And it's something that Franklin County has put a lot of resources, time, and effort into, including yourself. You've kind of launched these Soul Talks, which is to help kind of drop some of that stigma around just talking about something that really even as recent as 10, 15 years ago, we didn't talk about. What are you kind of looking at by doing these Soul Talks? How are these going?
Well, here's what we know. 1 in 4 Franklin County residents battle with some type of mental health issue, whether it's a disorder or a crisis or a scenario that might trigger a mental health scenario. And so we wanted to find a way to create a space where not only people could address those concerns, but access resources that might lead them to a healthier pathway. We know that mental health is physical health, and connecting the two and getting people to access those resources, we feel like makes for a better Franklin County.
Absolutely. And so the Wellness Within Reach resource guide, can you talk to us a little bit more about that, how people can get their hands on it?
Well, it's a free guide. You summed it up right.
Yeah.
A Wellness Within Reach, and the name speaks for itself. But there are over 200 resources that are listed here that range from every resource you might need to ones you might not even think about that you need, and then you see it and you're like, oh, this is a good number to call. And we put it in a nice book so that it's kind of like a yellow pages, if you will, or maybe blue pages, we call it, to allow people to access those resources in a private and comfortable way, a setting that lets them sort of address the range of things they might need to.
Right, because I think when people are, seeking help, they're already at a place of feeling overwhelmed maybe, and then they just go online and they're trying to look up phone numbers and who to call. It can be, a lot and overwhelming. So this is really nice to have it in one place that they can
100%.
use.
And don't forget about the stigma that comes with it. If you let's say you see something and you're like, oh, there's a billboard and it's saying, and then people know you're writing down this number that says, mental health service or whatever. And that may prevent some people from taking action. And so we wanted to create a sort of safe space book where you could, in your own home, in place of work or wherever, take a look at it, see if there's something for you. And we really tried to find a little something for everyone. This is the second version of the book, so we know that there's still some room to grow, but so far the feedback has been tremendous that people are accessing it and finding the things that they need to.
Right. And then one step that we've made, in just the past couple of years is the opening of the Franklin County Crisis Center, which has been a huge move, and I mean a massive, Herculean effort really to open up, because the idea of this is because before this thing existed, unfortunately, a lot of people who were having a mental health crisis would end up in emergency rooms or even the county jails, and they weren't getting the help that they needed. This crisis center aims to change that, and it's only been open about a year now. And it has done some great work over there. Yeah,
I'm not sure I could say anything better than the way you just laid it out. I mean, it's really a way to almost triage in the right way a crisis scenario and get the resources to that individual that might need them, instead of locking them up, instead of taking them to the hospital. Really finding the right thing, because sometimes it might just be simpler than what the system provides. And so we found that out, and we built this crisis center, which is cutting edge and something one of a kind, and not just Ohio, but even in the Midwest and perhaps nationally, where we're really working to get our residents empowered with resources so they can be successful. And here's the bottom line too, from an economic standpoint. It is much cheaper to treat someone and prevent the crisis than it is to treat it after something's happened, whether it's a medical crisis that comes from the mental health crisis, et cetera, et cetera. We know that providing people with resources along the way and getting them access is a much more economical way to deal with some of those challenges.
I've been in the facility. It's beautiful.
It is.
As like a person that's maybe experiencing, mental health issues, it's a comforting space for them. It's open, it's kind of green, you can see through windows, and it's kind of a different idea of what you would, expect a facility like that to look like.
And what I find unique about that facility in particular is that it is it offers both in and outpatient. Basically, somebody can stay there for a period of time as they work through that treatment. There are places for people to stay, and that to me is different than some of the other previous approaches that we've tried.
I'm so glad you said that, because I mean, I've been in elected office for 25 plus years, and there have been so many crises that I've seen over the years, whether it's someone on the street crashing out or a scenario where someone gets arrested for some kind of activity. All of them usually are linked to some form of mental health disorder. And so to be able to, as you said, to sit down with you in a very beautiful facility, in a comforting facility, and try to assess and evaluate what your needs are, and then provide that with you, and then get you on the right path, is a plus. Because I remember those old days. I remember the days where you were locked up or hospitalized, and it was very adverse. It was very it was not a fun thing to watch for anyone, no matter what the scenario was. And so today we can do it with a little more comfort, a little more care, and a little more approach to preventing a real crisis that could come from it. And moreover, I would just say that there are statistic line after statistic line that show if we address mental health, we can save on the physical health side as well, because mental health can also be triggers and contributors to negative physical health actions that could cost you, or could be a more serious issue for your quality of life.
Where does the crisis center grow from here? Because there's already a lot of services being offered, but what's next?
You know, for the way I would think of it, and I think the best person to answer that is the leader of Adam H. But I say the best thing to do is have a regional approach, so that it's not just this one facility that you have to be transported to, but that if you're in a mental health scenario need and you are in the far western part of the county, or you're in the far southern part of the county, that the transportation process doesn't have to be this sort of, you got to get there, that there are many centers that can take you in, assess you, and triage you to the right resource or the right layer. Sometimes we know that there are substance abuse issues involved in, and so to be able to connect those preventative services with the crisis services, and then link that to substance abuse or detoxification kinds of things, I think that's kind of what we're looking for, is this regional approach that no matter where you are in Central Ohio, you have a legitimate ability to access the resources you need to be successful and safe.
And it's as simple as walking in.
Yeah.
Their doors are open.
And, you know, and besides that, there's also been the online effort as well put in by Franklin County. We're talking the Credible Mind website, that if they don't have access to that guide or aren't quite to that spot where they might need to use that crisis center, there's also resources available to help you, point you in that direction somehow, somewhere online, right?
That's right. You can go to crediblemindcom, and the idea there is essentially a web-based program that allows you to be guided through a process to access other services or resources. And oftentimes, and for by the way, for Credible Mind, that's for any resident, that anybody can call that number free of charge. It's something we pay for our residents, because we know the value of making you as a resident the strongest you that you can be. That makes Franklin County the best place that it can be to live, work, and raise a family. And those are the things that we invest in: a Credible Mind, a wellness within reach guide, so that our residents can access the bucket of resources or tools they need to be successful. And that's really what Credible Mind and Wellness and Reach are all about. And the Soul Talk. You know, we're on our 9th Soul Talk series, and I keep saying, okay, that's enough of that. And then I get all these emails or calls or people talking to me on the street saying, when are you going to do it on this? We want to see this. And if nothing else, it starts and ignites a conversation about the value and importance of mental health and managing your mental health. And I think that's what's come of it. And in the bigger scheme, there are issues that are serious, even beyond the discussion and awareness points, like mental health parity in healthcare coverage. You know, we want to see healthcare companies giving you the same type of coverage that you get here for your medical services, for your mental health services. And again, we think there's a connection between the two. In fact, it's not we think, it is a fact. There's a connection between the two, both economically and scientifically.
You're obviously very passionate about this. You do the Soul Talks. Was there a moment in your life where you were like, I need to speak up about this. I need to help break the stigma? What was that?
Yeah, like every day.
Every day?
Yeah, like every day there's probably something.
Because a lot of people don't like to talk about mental health.
You know,
but was there a moment for you when you thought, I need to bring this to the public?
You know, there were many moments for me. But if I thought of one or two, you know, as I'm a little more reflective now, I think about moments in my life that I could have really used some support and some services that might have helped shape or guide me. What we know is that a lot of mental health issues don't even surface until around 14, age of 14. And so there's a critical window in time where something could happen that could really shape your mental health for the rest of your life. For me, you know, my father was killed when I was a kid, and I think about that often, about all of the trauma that came after that, all of the disconnect, the poverty, the things that came from that. And I think about what if that kid had services that could really sort of support him in that moment and make him a better student, make him a better person, make, you know, all the things that somehow shape you as an adult. And you think back and you try to deal with it. But there are everyday issues that families and people face all the time: divorce, financial problems, problems with your children or family members, health, you know, issues that I think are serious triggers that we all face. And we just have to recognize that we're in a moment of need and then take the step to address that. In my office, for example, we have, it's not uncommon for folks to say, I need a mental health day, you know, and me included, you know. And I was talking to my chief of staff the other day. He said, why mental health? I said, well, I need a mental health day, you know, and that's how it should be. We should be supporting one another as humans to say, hey, you don't look okay today, and it's okay for you to say, you know, I'm not okay today. And then the response would be, what can we do to support you for today? What can you take today off? Can you know, what can we do? And I think that would strengthen our humanistic nature of covering up the mental health issue, and just kind of say, I'm going to just plug through the day. I'm just going to go through it, because reality is it's going to come out in some other form.
Yeah,
absolutely. And it's never too late to get help.
Never.
Okay.
All right, Commissioner Boyce, thanks so much for
Thank
joining
you.
us.
Yeah, thanks for having me. Appreciate it.